Hello, everybody. My name is Lily Hubler, and for my technical presentation, I will be focusing on spinal cord stimulators, or SCSs, and spinal cord stimulation, which is a method of pain management that has become increasingly popular over the past decade, with over 60,000 Americans having this device implanted annually. My objectives for this presentation will be to discuss what a spinal cord stimulator is and how they work, the demographic of individuals whose device will help, and the benefits and downfalls of having this device implanted as a primary method of pain management. A spinal cord stimulator is a device that is surgically implanted that sends low levels of electrical current directly into the spinal cord to help relieve sensations of severe pain in an individual. It is done by having the electrodes go directly into the spine, which could counteract the painful sensations that the nerves are outputting by replacing them with a tingling sensation. There are two common types of spinal cord stimulators that are in use today, one of which is the conventional implantable pulse generator, or an IPG, which is an internal battery pack that will need to be changed surgically. The second type of spinal cord stimulator is the rechargeable implantable pulse generator, rechargeable IPG. This device has an external charger, which sits on its own charger, and the external charger could be placed over top the area where the internal charger is, and it will charge it by being held in place with a magnet. There are two stages to getting a spinal cord stimulator. The first stage is the trial phase, where wires are inserted into the back with the help of needles, and electrical currents are sent near the spinal cord rather than directly into the spinal cord. And it is generated pulses with an external pack rather than internal. The next phase is the surgical implantation. If the trial phase goes well and there are no problems and the patient likes the way that it made them feel, they will put in a more permanent internal battery pack that will do better with managing pain. Spinal cord stimulators are commonly used when non-invasive, non-surgical methods of pain relief just are not cutting it for a patient, such as spinal taps, spinal injections, and medications such as Vicodin and other opioids. For a spinal cord stimulator to work, there are three key components. One is the remote. This is what allows a patient to control when the electrodes turn on and at how strong of a frequency. So when they are in pain, they can press a button and help mute some of the sensations they are feeling. Next is the battery. The battery is inserted on the lower abdomen or near the buttocks, and it sends and generates pulses up through the electrode leads, which are connected between the vertebrae and the spinal cord. The leads are what generate the pain relief. Depending on where an individual is experiencing pain, the leads will need to be placed in a different area. If it's in the lower back, the electrodes will need to be placed in a specific area, rather than if it was in the upper back, the electrodes would need to be somewhere completely different, because the nerves send in different directions, and that will radiate the sensations to different parts of the body. Multiple kinds of people will need to use spinal cord stimulators as a form of pain relief, one of which is individuals with chronic pain, which is a type of pain that is nonstop. It could flare up, it could lessen, but it never really goes away, and there's no true cure. So a spinal cord stimulator is a great way to help cope with the pain and lessen it. Another type that might benefit from it is people like my dad was, which are individuals with multiple sclerosis. My dad had a spinal cord stimulator implanted to help deal with some of the pain that was caused from MS-related damage to the brain and spinal cord, which sent unpleasant sensations to the whole body. Another group of people that may benefit are people who suffer from FBSS, which is failed back surgery syndrome, which is when a back surgery is performed, but then later down the line, there's an error or the problem comes back, which causes severe pain that is hard to subside. A benefit of a spinal cord stimulator is it can greatly improve the quality of life of many, many, many individuals. Not only does a better quality of life improve physical health, but it improves the mental health. Everyone wants to be able to do what they enjoy, and it's hard to do that when you're in pain. A spinal cord stimulator can help families create more and more memories without pain. Another benefit is that it lessens the need for opioids. There's an opioid epidemic going on in the country, and using a non-medicinal form of pain relief helps people not even need to fear relying on an opioid. Another benefit of the spinal cord stimulator is that if at some point it does not work for the patient anymore, or it's not what they desire for pain management, it is completely removable. It is not a permanent implantation. It can be easily removed with a surgery. A downfall of the device is that it is battery powered, and the most common type uses just one internal battery and not the rechargeable type. And that means that with about 10 years of wear and tear, it will need to be replaced in order to keep giving the strongest amount of pain relief possible. Another downfall is that with wear and tear, it's possible for a lead to break or malfunction. If a lead breaks or malfunctions, it's going to require an additional surgery for medical professionals to go in and fix the wire. Otherwise, it could cause unpleasant sensations and minimize the amount of pain relief that is being provided to the patient. A final downfall is that with constant wear in day-to-day life over time, it is possible for the leads to shift. If the leads shift, it's going to change the focus area of where the electrodes are hitting the nerves, which will cause tingling sensations in other parts of the body while not targeting the area of pain, which will cause many, many, many unpleasant sensations for the patient. Thank you.